Hello and welcome to our podcast through the University of Kansas Medical Center. My name is Angela Carrasco, and joining us today we have Chloe Pfeifer, a third-year Doctor of Audiology student in the Intercampus Program in Communicative Disorders at the University of Kansas. Thank you for joining us today, Chloe.
Thanks for having me. I'm happy to be here.
You bet. So could you tell us a little bit about where you're from and how you became interested in the field of audiology?
Yeah, sure. So I grew up on a farm in western Kansas, and I knew growing up that I wanted to go into the medical field. I just wasn't sure in what specialty I wanted to go to. I knew I didn't really want to go all the way through med school, but I wanted to do something where I was working with people and helping people. And my mom actually had taken some classes when she went to K-State to be a speech therapist. And so she kind of put that idea in my head when I was in high school. So I went to K-State for undergrad, and I was like, okay, I'm going to be a speech therapist. I just knew it. And I walked into my first class, and they started talking about audiology and speech. And I realized immediately that speech wasn't for me. Speech has a lot of gray areas, and I like the black and white of audiology. And so my first day, I switched over to audiology, and I kind of have some experience in the field. I have some ringing in my ears that I dealt with when I was in high school. So I was familiar with audiologists and ear, nose, and throat doctors. So I went in that direction and haven't looked back.
Wonderful. I hear a lot of students take the same types of courses for speech as audiology anyway, so you can oftentimes wait until your junior or senior year before you even realize that audiology might be what you want to go into. Is that correct?
Yeah, you can. A lot of people switch over your senior year, but I knew my first day, and so I started looking at graduate programs. I remember doing that as a freshman, and I was like, oh man, you're going to go to school for 8 years, graduate school for 4 years, you're crazy, but here we are, we're almost done.
Good for you. What type of research are you doing right now, and with whom?
So for our program, we have to do a research project to graduate, and it's called the AUD project. So I am doing mine with Dr. Chertoff and Dr. Mann. Dr. Mann is the tinnitus provider in our KU clinic, and she does a lot of stuff with TBI. So she has a bunch of research with her tinnitus patients, and that was something that interested me because there's so many people that have tinnitus. And tinnitus is when you hear ringing, buzzing, chirping, swooshing, crickets, those kinds of noises in your ear in the absence of an external sound. Mm-hmm. And that a lot of people suffer from that. And so it was something that interested me and having a specialty that I could have for the future. So I kind of wanted to look at her research, and she had a bunch of research that she had mined for her PhD. So I'm looking at when people come in for a tinnitus evaluation, they take a survey, kind of how the tinnitus is affecting their everyday life. So I was looking at the scores on that survey before they have the treatment and then after treatment. So does the treatment actually work, and what kinds of treatments help the most?
Neat. Now you mentioned TBI. What is that?
A traumatic brain injury.
Okay, so a lot of patients come in with a traumatic brain injury would suffer tinnitus?
Yep, tinnitus is a common symptom for TBI, for someone with a brain injury. And it's also just can happen from people that have hearing loss. It can happen from stress. It can happen from a lot of things. So a lot of people suffer from it, and it's a big thing in the field right now.
Very neat. What type of clinical placements have you held, and which was your favorite?
So outside of our KU clinic, I went to a private practice the first semester, and I really enjoyed that just because I would like to have a practice of my own sometimes, so I enjoyed learning the business part of that. Then last fall, I was at the Midwest Ear Institute at the St. Luke's Hospital, and I really enjoyed that because I was with cochlear implants and auditory processing disorder, and I was able to work with babies all the way up to really older adults. Mm-hmm. And so it was nice to get that wide range of people and experiences. And now I'm at the VA, which I also like that. So I've liked all three of my placements. I feel like they've been good fits for me. The VA is interesting. You know, I like helping the veterans, and I just seem to mesh really well with that population. So I like them all. What happens when you like all three of your placements? How do you decide what's really right for you then? I don't know. I coming into school, I've never thought I love children. I didn't think I was going to love working with children. Mm-hmm. But actually, I've really liked kids so far, which has been kind of it was a surprise for me. But I also really like the older adults. So the good thing about if I'm going back to Western Kansas, is that there's a very big need for audiologists back there, so I would have to serve a wide population. So it's kind of nice that I gained all these experiences, and then I get to use all of them when I go back home.
Well, speaking of experiences, have you held any jobs while you're in your AUD studies?
Yep, so my first year, I worked in a boutique for a little while because I wanted to kind of see what I could handle with the grad school load. And then just this last semester, I was a graduate teaching assistant. I taught the first years in their diagnostics lab. And then my second year, I was a LIN trainee.
What's a LIN trainee?
So a LIN trainee, LIN stands for Leadership in Education and Neurodevelopmental and Related Disorders. And a LIN trainee, you work with other interprofessionals. So I was working with speech therapy, PT, OT, psychology. There were parent advocates, there were self-advocates, psychologists. There was a wide range of people from KU, and some people were out working in the field, and we have a class together. So we all work together, and we gain different perspectives, and we learn about neurodevelopmental disorders. So it's housed here at KU in the Center for Child Health and Development, and they have a big focus on autism there. So we were able to learn about autism and gain experiences from other people, learn about trauma, how to work with people that have been through trauma, how to work with people in underserved populations, how to work with all different cultures. So it was a very good opportunity for me, and I would encourage anyone that's coming to KU to really consider that for themselves.
That's great to be able to have that experience with interprofessional departments that you might normally not get to work with.
Right, because audiology is OT, PT, and speech, they work together in the real world all the time. Mm-hmm. In audiology, you don't think about that right away, but we really do. We're working with other people, and so it was nice I feel more comfortable now, referring to other people and knowing to consult, a PT for something, or being able to say, oh, your child I'm having some concerns, I know where I can send you.
Right.
Just to be more informed about what other professionals are doing in the field is nice.
You bet. Well, I heard that you won an award for the research you did with Dr. Redding as part of LIND. Could you expand on that?
Yeah, so for your LIND traineeship, you also do a research project. And my passions is rural health, and so I wanted to look at some rural health areas in Kansas. So I did my research with Josh Burbank. He's a PhD student here at KU in the speech program. And he is a Native American, and he's from the Four Corners area in New Mexico. And so he is doing a lot of his research with the 4 tribes here in eastern Kansas. Mm. And they were pretty foreign to me because in western Kansas, we don't have any tribes. But it's a similar situation with underserved populations. So that was a big attraction to me, was that these tribes here in eastern Kansas are greatly underserved. They're a rural community. I kind of was able to identify with that a little bit, mm-hmm. but the Native American aspect was a completely new thing for me, and so I really enjoyed listening. Josh does a lot of stuff with kindergarten readiness and education for parents, education for healthcare providers out there, because the healthcare providers need to be educated on how to serve this population too. Mm-hmm. So I kind of dove in with his research, and Native American children are at a greater risk for ear infections, and then that can cause other delays. And so we did a lot of educational stuff. I went to a powwow, which was a great experience, very new experience for me. Right. We did an educational summit where we had providers come. We've done hearing screenings. And so we took all of that research and all of that data, and it's called community-based research. So it's not the typical numbers, statistics that we're used to. It's very different. It's about working with the community and finding what they need and creating a relationship with them. Mm-hmm. And so that's what I chose to do for my LIND project. And then I was working with Mary, and she was a social work trainee. And so we did all of this together, and we presented a poster at EDDI. And EDDI is the Early Hearing Detection and Intervention Conference. And so there were, parents, people that have hearing loss there, audiologists, speech therapists, people that work with cochlear implants, all of these people around. And we presented our poster, and we won the Best Student Poster Award. So that was an exciting
Awesome.
For all of our hard work that we put into that project. It was exciting.
Good for you. So when you graduate next year, with what community or demographic do you wish to practice? And I think you're going to say rural health, but what would you like to do?
You're right. So for my externship, I am going back home to Western Kansas, to the Garden City area. I will be at their hospital working, and I hope to stay there when I'm done with my externship. I'm not sure the exact number, but the number of audiologists on the whole western half of the state is like 5 or so. It's very low compared to the eastern half of the state. So there's a great need. And so I want to work in the hospital. There's a couple different options. I've talked about opening up my own practice, going in with, an optometrist, or staying at the hospital. We're going to try to expand the audiology services around Western Kansas. So that's kind of up in the air right now, but I want to stay in Western Kansas.
That's a great goal. I grew up on a farm in rural Missouri myself, so I'm familiar with how there might be some needs, and it sounds awesome that you're going to try to meet those.
Yeah, I'm very excited. The people in rural areas have to drive and to see healthcare professionals, specialists, and it's a big challenge.
So this theme of rural health that we've had throughout our discussion, what are the complications that residents are finding regarding their audiology healthcare when they don't live near these bigger cities?
Yeah, that's a great question. So I think that when people live in a big metro like Kansas City, that we don't think about that. When I was growing up, I was totally used to driving 3 to 4, 5, 6 hours to a doctor's appointment.
Wow.
And people here, in the metro, they're like, oh, I had to drive in from Blue Springs, and oh, that was a 45-minute drive. And I was like, oh no, I drove 6 hours to see a specialist, in a day and back.
Wow.
So it's a very common thing. And so right now with audiology, any of the pediatric population in Western Kansas, if they have a hearing loss, the majority of them are driving to Wichita to get those services. And it's great that Wichita has that, but it would be even greater if we can keep those kids home to a closer hospital.
Sure.
So that's one of my big goals, because when you have a hearing loss, you're going to the audiologist at least once a year as a kid, if not more, because babies' ears change all the time. So we're constantly having to get them new ear molds, programming, hearing tests. It's not just a once every 2-year appointment. It's at least every year, if not every 6 months, if not more than that. And these parents that have a lot going on, oftentimes these kids with hearing loss, that's not the only thing they have. They have other neurodevelopmental disabilities or other things going on, other specialists they're going to, speech, they're driving. And so it's like, if we could keep those kids home in Garden City, or if they're from around the area, much shorter drive than having to drive to Wichita, that would just help them, help their parents. They wouldn't have to miss school. So it's things like that. That's one of my big goals when I move back, is to help with those pediatric population, to get them. But even adults, my dad came up here to get his hearing aids. My grandma did the same thing because I'm here in the program. But there is the healthcare provider that I'm going to work with my extern. Well, she's booked out 3.5, 4 months.
Wow.
Because there's no one out there. If you want to do it now, you kind of have to drive. You have to drive to Wichita. And so we just need more healthcare professionals out there. And
if you have hearing loss and you need your hearing aid to be adjusted, nobody wants to wait 3 months, let alone not even like a week to have that fixed.
Yep. And so Dr. Kim Hendricks is who I'm doing my externship with, does the best she can. And she's seeing, 15, 16 patients a day, trying to squeeze in the little things like, Mom, my hearing aid's dead today. Oh, okay, what can we do to fix that? And plus all the regular patients. So she's really overwhelmed. So I'm excited to go back and help her during my externship, and then hopefully after that.
Now, do they do hearing screenings for babies in all hospitals in Western Kansas as well?
Yep. So actually, Kansas is ahead of the game across the nation with the percentage of babies that are getting screened. So shout out to Kansas for that one. I learned that at the Eddie conference. So every baby is screened before they leave the hospital. Here in Kansas City, or like at KU Med, there's a tech that does that. The students in the audiology department, do the NICU screenings. But in Western Kansas, it's a tech. But if they fail, then they have to drive all the way to Wichita. As opposed to here, if the child fails the NICU screening, then in a month they come across to our KU clinic. Not having to drive all the way to Wichita just for a failed hearing screening.
With a newborn baby, and now the parents are nervous. They just want to get that taken care of as soon as possible and understand what's happening.
Right, but in Western Kansas, we just need the people, we need the tools, we need the equipment. So that's something that I'm hoping to work for.
So what can you recommend to patients to overcome these discrepancies and to advocate for themselves if they live in a rural community?
Yeah, I think that That's it. One of the biggest thing is advocating for yourselves, talking to the people around you, to the hospital administrators, saying, can we get another audiologist here? Can we get another, whatever specialty that you need around? And I think another thing is just encouraging people to come to Western Kansas. It was an easy choice for me because I was born and raised there, and my family, my fiance are there, so it's a no-brainer for me to return. Mm-hmm. But for someone that grew up in Eastern Kansas or, anywhere else, rural Western Kansas is a lot different than the Kansas City metro area.
Right.
It's just a whole different ballgame out there, and so it's hard to get people. It's hard to get surgeons. It's hard to get doctors. It's hard to get all specialties out there. So it's like, if you grew up there, it's nice to return home. Mm-hmm. And serve the community. And I understand that's not possible for everyone, but, there's a lot of efforts out there now to recruit people back to Western Kansas.
And I know with the amount of baby boomers that are aging now, there's a lot of hearing loss out there. So the field of audiology is an excellent field for students to go into at this time.
Right.
So you probably will find a job when you're graduating. I know most of our students have jobs before they even graduate. So that's a nice feeling to have, to know that you will find a job as soon as you graduate.
Right. And I think that, over-the-counter hearing aids are becoming a thing. And I think that just hearing health is in the news a lot. And people are going to start hopefully taking action on their hearing health more, which will make the field even more popular. Mm-hmm. And like you said, the baby boomers are growing. There's a lot of them. And so as the younger generations, it's kind of our job to help take care of these people.
Right.
So it's a big responsibility, and I think the field of audiology is going to be a big one.
You bet. So let's turn a fun question around now. Do you have any favorite podcasts to which you subscribe?
I listen to a lot of podcasts because I drive 5-6 hours home. So it's helped me keep me sane during this grad school time to listen to those podcasts on the long drive. Serial was one of my favorite ones, Up and Vanished. I listened to some silly ones like The Basement Yard.
So I have no idea what any of these are. Can you explain them?
Serial and Up and Vanished are two really popular ones about, one of them was about a man that he was convicted of murder, but then he's saying that he didn't do it. So it's like they're digging through the case and how did he get convicted when there was such little evidence? And it's a big thing in the news right now. But I won't spoil that one for you. And then the Up and Vanished was an unsolved murder. So it was similar to the Serial one where these people were digging at this 15-year unsolved murder trying to figure out who did it. And then because of the podcast, now there's a bunch of leads and they kind of actually might have figured out what happened to this poor girl in Georgia. So I like the murder mystery ones.
You like kind of gal in the background.
Yeah, I like it. It's just very interesting to me. So those are the ones that I like the most.
Well, Chloe, thank you very much for joining us today and sharing your knowledge on rural health.
Thank you for having me. It was really fun.
You bet. Well, good luck to you in your final year of the AUD program. And to our listeners, that was Chloe Pfeifer, Doctor of Audiology student in the Intercampus Program in Communicative Disorders at the University of Kansas. Be sure to subscribe to us on YouTube to receive notifications when our next podcast drops. Thank you for listening, and rock chalk.